Well, anyways, I will get going. I'm Diana Fitzgerald. The first question somebody else had with the earlier session was, what do all these jargon mean? Those are my credentials, if you will. I'm a registered nurse, certified nurse midwife, and a nurse practitioner. So I'm going to get into a little bit about what that means. A lot of the times I find in healthcare, people don't understand the differences between a nurse, a midwife, a nurse practitioner, a PA, a physician, all of that. So I'll clarify a little bit of that. And then I'm going to move into holistic versus integrative healthcare. A lot of the jargon that's out there says integrative medicine. I think I prefer the word healthcare. They're not interchangeable, but they are in part. Healthcare, medicine. Medicine kind of has its own coin, and I think in order to provide care for a human being, you have to give them health care, not medicine exclusively. So it's integrative health care. We'll get into the differences as far as the two of those go. So again, who am I? What do I do? I am a full-scope well-woman care provider. So people often say, oh, you're a midwife, you deliver babies at home. I've never attended a birth at home. I'm all for it. I think it's fabulous, and especially after 20 years of being in healthcare, I think home birth is definitely most appropriate. 2/3 of the globe have their babies at home, and most of them are attended by midwives. Midwifery is one of the oldest professions on the planet. So really, for doctors, didn't attend births until about 50, 75 years ago, when it was moved into the hospital setting. So, a certified nurse midwife means I have a master's degree in nursing, so I've gone on for extra schooling. But midwives take care of all ages, so from young with menstrual irregularities through menopause and beyond. I often see women in their 70s. Do I really need to come for these exams anymore? Yes. If you're a healthy 76-year-old woman and I feel something on your ovary, by all means, we take it out. You live another 10 years instead of 6 more months. So absolutely, I think, well-woman care is the forefront and exactly what we need to do as women. Nurse practitioner, that's my program that I did of study. I got my midwifery so I could catch babies. I don't like to say deliver them because the women deliver them, really. And I got my nurse practitioner as well, my women's health nurse practitioner at the same time. Midwives and nurse practitioners alike can prescribe. They have full prescriptive privileges. One of the main differences between a midwife and a nurse practitioner, other than attending babies, attending mothers that have their babies, is that a midwife doesn't need a written contract with a physician. I have a verbal contract with a trusted physician, but I don't need an actual legal written contract to practice. So, I'm fully functional independently. I don't need to have permission to practice, and that's for New York State. So, all of that, I think it's very, very important for people to know where that is. This is all linked. The New York State Office of the Professions, this kind of dictates what I can and can't do. It has, consumer information. It has license statistics. This thing isn't working, so I won't keep pointing it. Questions and answers, electronic prescribing, all of the up-to-date things. So if you have internet access and you go to New York State Department of Education.gov, it's going to dictate exactly what a midwife can do in New York State. So, again, it's summarized there pretty well. Annual exams, health promotion, disease prevention. Okay, so instead of the model of treating a disease, I'm treating the prevention. We are trying to encourage health promotion, the well woman, making sure that everybody is healthy. Very, very frequently, a nurse practitioner or midwife will pick up, abnormalities, mostly because we're so used to seeing normal. So we see normal, 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 normal. Abnormal just hits us right in the face. First exams for young women, preconception counseling, Comprehensive maternity care, I have stepped away from comprehensive maternity care. I'll talk about that in a little bit. Evaluation, common health problems, public education, referral to specialists. And likewise, the New York State Office of the Professions, really kind of looks at the different levels of nursing. So a registered nurse, what can an RN do? And then if you scroll on down, you're going to see what a clinical nurse specialist can do, what a nurse practitioner can do. They're moving into doctoral degree as far as nurses go, so they can do a lot of research. Mayo Clinic is on the up and up. A lot of research is done by doctorally prepared nurses. So this really is a great resource for the public because a lot of people don't understand. One of the main things that people ask me, what's the difference between a nurse practitioner and a PA? PAs are more medical model, and nurse practitioners are a nursing model. So, being a nurse, we focus on the prevention of disease and health promotion, as opposed to a PA functions with a physician and focuses on the medical model. So that's the way that we're trained is very, very different. So, and you can often see that just in interacting with different providers. Diagnose, treat, prescribe. We already talked about that a little bit. Definitions: holistic, integrative practitioner. What does that mean to you guys? When you hear the word holistic, what does it mean? Natural? Whole person? So looking at non-drug related. Any other notions? As far as integrative, what does that mean? Uses both, all aspects. So if we go to Greek, the idea that the systems, physical, biological, chemical, social, linguistic, it doesn't matter the system, and their properties should be viewed as wholes, not as collecting of parts. So the medical model, or the Western model, if you will, kind of really focuses more on the digestive system plus the cardiovascular system equals this. So, you have to look at all of the systems, even in the medical model, but as far as a holistic approach, you're focusing on maybe what you can't see as well. You can't necessarily see how the mind is thinking or the person's past or their spiritual beliefs and incorporate it into their health care. So that's the holistic model of care. So Western medicine focuses on the scientific process. And I've got a slide in a little bit that really kind of incorporates that. Integrative healthcare, again, when you're looking at definitions, they often use medicine and physician. So I'm going to kind of replace it a little bit. Combines alternative modalities with evidence-based medicine. Proponents claim that it treats the whole person, focuses on wellness and health rather than on treating diseases. Emphasizes patient-provider relationship. So, there are integrative physicians, there are integrative PAs, there's integrative nurse practitioners, there's integrative midwives. So, provider. So we're going to use provider instead of physician, if you will. I love physicians. There's a time and a place for physicians. So not always, as far as when you're focusing on health and healing from something that's already been managed medically, moving into a different approach is not a bad idea. So you do want a physician doing surgery. You don't want me to do surgery. I don't want to ever do surgery. I used to assist with surgeries, but, again, as far as the medical model, that's where you want a physician. So Europe, we already talked a little bit about midwives. They're doing 2/3 of the deliveries at home. The other third are done by physicians because that's a good thing. You do want the doctors handling the complicated people. So wholeheartedly, I love my physician. The physician that I refer to, I trust him and he trusts me. So, we have a good working relationship. Often people are, well, is there a woman that I could see? And I do have a good relationship with female physicians as well that would certainly take care of the patients that are beyond my scope of care. So I can only go so far. If I find something that may need surgery or is not within my realm, I don't want to take care of it. I would refer the woman. All right. So again, many parts, one body. That's really what a holistic practice focuses on. Come on. There we go. concept. So at the afternoon session, I realized my notes aren't on the zip drive that I plugged in here, so I'm cheating a little bit, making sure I cover everything. So Western medicine, medical doctors and other healthcare professionals treat symptoms and diseases, drugs, radiation, surgery. Those are the main pieces and components of Western medicine. Western medicine is derived mostly from Europe. So, as you look at medicine as a globe, Europe kind of came over here about 400 or 500 years ago, not even. Their medical model came over here about 400 years ago. So when you're looking at the 80,000 years we've been on the planet, it's fairly new. It's a fairly new medical model. So if you move into China, we're going to talk a little bit about their healthcare beliefs, and then if you move into India, they have very similar medical beliefs, and then if you move over to, Central America, South America, it all kind of blends in the different belief systems as far as taking care of people who are not well. So integrative, you want to focus on preventing that. So a lot of my focus is on preventing it, or figuring out if you do have a concern, what can we do that isn't necessarily a drug, radiation, or surgery we can do first. So very frequently in Western civilization, we get very impatient. We like to have a quick fix. So very, very frequently, problems have developed over several years. So sometimes it takes time to undo what has happened. Take me, for instance, and we're going to talk a little bit about doshas and different body types. For 20 years, I didn't sleep. Catching babies, I was up all night. My diet was not good, so I had chronic problems with my kidney and kidney stones. Now that I'm moving into more of regular sleep patterns and eating the foods that I should be eating, and I still have work to do, don't get me wrong, then I'm not having as many problems. But it takes time. It's not a quick fix. Alternative medicine, alternative modalities, alternative healthcare. Any practice that puts forward as having the healing effects of medicine but does not originate from the scientific method. So that is definition, if you will, about alternative medicine, alternative modality. Not part of biomedicine, sometimes contraindicated by scientific or established science. So an established science, again, is defined as the past 400 to 500 years. So, you look at holistically the history of the world, you have to draw in a lot of that. However, very, very recently, past 50 years or so, increasingly, there's a lot of studies coming out. So, you hear in the media almost daily about how meditation has been proven to help, police officers or post-traumatic stress disorders. And how acupuncture is actually curing many different problems. The Mayo Clinic has tons of research studies out there about how this alternative stuff actually works. It really is working. So you're trying to increase the research. A lot of the problem is the funding. It's hard, it's expensive to do a gigantic research study to prove that it's working. So that's where you get into the scientific method. So even though alternative medicine doesn't participate with the scientific method, it is starting to. We're really starting to be able to prove that this stuff is working. Examples: naturopathy, homeopathy. Naturopathy's wide array: herbalism, acupuncture, diet, lifestyle counseling. Homeopathy uses animal, plant, mineral, and synthetic substances in the equation. So homeopathy is very similar to drugs. You're essentially using drugs to cure illnesses. So, essential oils, on the up and up. A lot of people are starting to talk about essential oils. What's the difference between herbalism and essential oils? Herbalism uses the actual herbs, so spices on your food. Essential oils I've just learned, a lot more potent, anywhere from 100 to 10,000 more times more potent. For example, one little thing of lemon, an essential oil, a pure therapeutic grade essential oil, is about 75 rinds. So you actually need like 75 lemons to make one little thing of lemon essential oil. So it's quite impressive. So on that note, you have to be careful with energy. You have to be careful with essential oils. You have to be very careful if somebody's already on something and then you add a piece of the puzzle. So, I'm not here to diagnose you or treat you. I'm here to give you information. So, I can't, if somebody comes up to me afterwards and says, oh, what would you do? Unless you're under my care, I can't, give you that prescriptive privilege, if you will. Reflexology. So I'll go to the next slide real quick. So, I've spent some time recently just kind of Googling different images like this, and they all look like this. They're all about the same. They're not exactly the same. And you really have to, you can't just go online and pick one, but if you look, for the most part, everything is connected in your feet. And we're on our feet all day, every day. I can promise you, right here is spleen 7, and it will release a placenta. Because as a midwife, I can't do surgery, so I couldn't go in and get that placenta. So if I had a woman and her placenta wasn't coming out, about 25 minutes in, I would push on that little pressure point, and sure enough, the placenta would come within 3 to 5 minutes. So it was fantastic. Both. I would go to both. I would alternate. So, because very frequently after they have their babies, they still contract. So, they'd have a contraction. I'd push a pressure point, and then within 3 or 5 minutes, alternating legs, that placenta would come out. Worked like a charm. Some great pressure points in the back to get them to deliver. So very similarly, you can use some of these pressure points for menstrual irregularities and, for menopausal complaints. So, or incorporating some essential oils, if you will. Traditional Chinese medicine uses acupuncture, acupressure, qigong, tai chi. Qigong, I just wanted to make sure that I defined it right. An ancient Chinese healthcare system integrate physical postures, breathing techniques, and focused intention. So really honing in on your body as a whole and specific postures. Everything stems off your spine and your feet. Everything. So if you are incorporating your spine, that definitely can play in how the rest of your organs function. So, chiropractic care, craniosacral therapy. Has anybody ever had craniosacral therapy? Oh, it's fantastic. It's the most gentle and... Oh, that is not okay. Okay. I went to sleep. Kind of like Pandora. Yes, I'm still here. So, craniosacral therapy, they use the muscles in your head and in the top of your neck and spine to align your entire body. So I see a doctor of osteopath, and she does craniosacral therapy. She's a full scope practitioner. And my 18-year-old insists I take her to get this craniosacral therapy. It's definitely acting up. It's not necessarily, a chiropractor doesn't always do it. A doctor of osteopath is different than a chiropractor. But to align your spine and to make sure all those nerves are integrated the way that they should. Light therapy, music therapy, a lot of light therapy is coming out. Mayo Clinic's doing some fabulous research on light therapy, particularly for something called seasonal affect disorder. We are moving into seasonal affect disorder. We've had beautiful summer, gorgeous, lots of sun. My vitamin D level is actually pretty good. But light therapy, our bodies need the sun. We need to protect our skin, but our bodies need the sun. So because of that, a lot of research is coming out about light therapy for seasonal affect disorder. Music therapy, Golisano's Children's Hospital actually staffs a music therapist. So that is on the up and up as far as research goes. So how music is incorporated. Tons of research to show that it totally stimulates your brain. And I used to play Mozart for she's now 13, and she's smart as a whip. I don't know if that's the thing. Nonetheless. Energy medicine, a little different. Reiki, Qigong, we talked a little bit about the Qigong. Reiki. Anybody ever heard of Reiki? Anybody ever had a Reiki treatment? Reiki. Okay. Take your hands, rub them back and forth if you want. Really get some good energy, some good heat going. And then just gently put your hands together. And you can almost feel a little bit of a magnet effect. So if that energy, so if you define energy, how is it that we believe we can send pictures into outer space and they'll end up on her phone? But we don't believe that we can help this energy channel. So it's looking at what energy is. You have to actually think about it in a different way. And there's a lot of research, again, coming out that it is very, very effective, and it is real. It's not just hullabaloo. So, and there's increasing people thinking, oh, you know what? It does work. I went to my last Reiki session. I'm a Reiki provider, and sometimes we get together, and we have these Reiki shares. We share Reiki to make sure that we're doing it right and that we're practicing our skills. And without me telling them, they didn't know my medical history, boom, their hands went right here. So, and I have a pretty decent-sized kidney cyst, along with a stone there, and they knew. That's just a little piece. And we need to develop the research to prove it. So, and that's where you get your doctoral degrees and things like that working on it. So, I got time. But that's Reiki. That's energy medicine, using the energy that we have accessible in our own body to heal, if not heal, then to allow relaxation, so then our bodies can heal. Oh, how about questions so far? Nope. Okay. Shh. You got a question? Yeah, it doesn't do anything. I mean, again, I am not a craniosacral therapist. I cannot tell you for certain. But having seen it done, it really is very minimally invasive. The reason my daughter likes to go is she had a concussion 2 years ago. So she's very scared of anybody manipulating her back and her neck. So, and it's very, very gentle. So, I would advise you to speak with somebody who does do it. I can't, again, prescribe and treat, with you guys here today unless you're under my care. But it's fantastic. They use more the muscles than the bone. So the muscles, and if you think every ounce of my tension goes right here. And it's really incorporating, just releasing some of that. So, there is science behind it. There is a way of learning it. There is a specific way to do it. It's on my bucket list, but I'm not there yet. A lot of things on my bucket list. Yes, doctors of osteopaths. Mm-hmm. Not a lot of DOs, no. But if you go to the AMA, the American Medical Association, and type in that you want a DO, they would pop up different DO providers. My kids actually see one of their pediatricians as a DO. So that's fantastic. Exactly. Yeah, doctor of osteo. Right. It's very similar to PA, nurse practitioner. Yep. So, it's fantastic. Yes. Very frequently, flex benefits will cover a lot of alternative modalities. There's not, increasingly, insurances are starting to offer. Again, because they need it to be research driven. It needs to come from the scientific method, which is, it takes time. It takes a little bit of time to prove that what we're doing is going to help people. But like gym memberships are starting to be covered under flex benefits. So, usually I encourage people to find out what their flex benefits are and what their reimbursement is. So, yeah. Oh, yeah. Not yet. Not yet. But it takes, again, it takes time. This slide is a little bit different as far as shamanism. A lot of people associate shamanism with a cult. Okay, and, shamanistic. Well, half the globe practices shamanism. North America, Mayan, African. A lot of the globe is, and it's really healing through spirits. And if you move on to Christian faith healing, it's the same thing. So you're praying in order for healing. And that's exactly what shamanism is. So they do incorporate, there's different types of shamanism where they use, they induce altered states and such, and I'm not advocating any of that. But to clarify a little bit about the definition of shamanism, I just spent 2 weeks in Guatemala with Mayan midwives, and they are Christian. They're Judeo-Christian, Catholic. But they've been raised over the past 3,000 years with a lot of Mayan beliefs. So they believe in a lot of chanting and praying to your ancestors and spirits and so on and so forth for the healing or the well-being of the mother and child. So, it was really eye-opening, particularly because they didn't even speak Spanish. They spoke they really spoke Mayan, so me even communicating with them through Spanish was very, very difficult. But universal language, we had a good time. Carried things on my head and everything. I did. It was fantastic. I wish to goodness gracious that I had learned how to carry my babies on my back. I wish I would have had a lot less hip problems. I carried them on my hip. If I just flung them on my back with the thing that they use. I'm telling you, it's crazy. Crazy works. And if it works and it won't hurt you, why wouldn't we do it? And that's really more of the point. Ayurvedic. Full disclosure right now, I am not an Ayurvedic provider. I will be someday shortly. That is next on my list because this is really where I believe in a lot of health and healing, is Ayurvedic modalities. It is the sister science to yoga. Anybody do yoga? Yoga is fantastic. And even if you are just doing very basic poses, anybody on this planet can do yoga. So there's fantastic yoga community in Syracuse. So there's 3 or 4, 5 that I can think, yoga studios that have a wide array of classes, from very beginner to chair yoga. I think I saw a chair yoga at the Y class. We just joined the Y. So yoga, it really can incorporate healing. So if you can get your body to move in a way that is more beneficial for your blood flow and your lymphatic system, your own body can heal. So Ayurvedic principles really go hand in hand with yoga. So, and although I'm not an Ayurvedic provider, I will be because I really think that they're very, very firmly in the Ayurvedic philosophy. So energy, again, when we look at energy, it's a subtle life force. Again, in Chinese culture, it's the qi. Judeo-Christianism, it's the spirit. In Ayurvedic, it's called doshas, But they also have, qualities, physical characteristics in your dosha. So your dosha is the spirit plus physical characteristics. So, and I'm going to move into that in a little bit. But I really want you to know, I'm not an Ayurvedic provider, but I will be someday, soon. So holistic healthcare. So as far as the starting point, instead of looking at what is wrong, what is not wrong? So when I have somebody come to me for care now, I've moved away from catching babies and I've moved into really focusing on the well woman. So if somebody comes to me with menopausal complaints or with menstrual irregularities or certain concerns and they want me to fix it like that, we have to focus on what is not wrong first and move forward from there. So 2 of the main things is how do you handle your stress and what is your diet like? So, and those are 2 big things that take a lot of time to change. Preaching to the choir. So, and because it takes an awful lot of time to change, when they come to me, I give them the full understanding that I don't have a quick fix. So, however, I will spend as much time with you as you need. So that is where you get into holistic health care. So instead of coming in with a problem, the nurse has taken the history, you go in to see the provider, 15, 20 minutes later, you come up with a plan, here's a drug, we'll see you in a couple months. So I'm able to take the history myself, find out who you are as a human being, what are your beliefs, what happened to you when you were 22. You know, does that play into how your mind and your cortisol is working? Our bodies have hormones, and they all work very, very closely together. So if we're under a constant state of stress and we have a very, very high energy job, or we've got 5 kids at home, that all plays into how our cortisol works. As far as our cortisol tells our hormones what to work, and then we're going to get into a little bit about hormones as well. So it all kind of goes in together. So handling your stress is number one. And again, it's very hard for me to tell any woman that, oh, you need to handle your stress right now. No, it takes time. Everybody takes a little bit of time. And as far as diet goes, we all have different body types. My body's different than hers. We need different foods, different types of foods. This is that this afternoon as well. Our bodies need different types of foods depending on the season, and that's where you get into the Ayurvedic principles. Then we focus on what's next. Instead of looking at what's wrong, first we focus on what's not wrong, and then we kind of look into stress and diet, and I'm going to get into some Ayurvedic principles and how I incorporate that a little bit. And then we move on with what do we do next, because sometimes they need a quick fix. Not only that, but I do have to make sure there isn't something incredibly wrong. So if she comes to me and she has ovarian cancer, I would never forgive myself if I said, here, have a diet change, and because that's not appropriate. So you have to use integrative modalities in holistic thinking. So they have to kind of flow into each other. Meditation, yoga, retreat. So as far as handling your stress goes, meditation, again, I think that term is changing. I think people are much more accepting of the word meditation now. Not entirely, but yeah, I think the actual connotation of meditation is no longer associated with some kind of hullabaloo because it works. So a great book that I just read, De-Stressifying, the whole book is on basic meditation. So it's by David G. He's fantastic, very, very basic book, awesome. And we're going to end with one of his little 16-second meditations. So trying to devote a little bit of time every day to quiet your brain. And that's the focus of meditation, nothing else. You can't stop the thoughts from coming in. We're human beings. They constantly come in. It's saying, okay, I got you. I'll deal with you later, and letting the thought go. So a daily meditation, which again, if somebody's not used to it, I can't sit here and tell you to do meditation every day. It's going to change your life. It will, I promise. But it takes a little bit of time to get into that. I've got 3 kids. I'm running all over the place. Trying to find 10, 15 minutes sometimes is very difficult. And I get that. So meeting where they are at. So somebody who has had a high-stress job for 30 years, you're not going to get them to meditate every day. That's not even possible. You're not going to get them to change their diet like that. That's not even possible. So meeting the person that's in front of me where they're at. And that's why it has to be integrative instead of holistic. You have to incorporate the integrative modalities into the holistic approach. Retreat. That leads me to this. This is a friend of mine. She actually works at SU. She does a fantastic job. She actually is having a retreat up at the Minnowbrook Conference Center. So any and all can check out the website for more information. She's really low-key, kind of a calming person, as opposed to my dosha is a little bit different than hers, so which is fine. But retreat, spending time to step away and figure out, okay, what do I? This past weekend, I sat in my hammock for about a day and a half straight. Got up and ate. That's about it. It's fantastic. Our bodies need that, and I didn't know that 10 years ago. So, and when my kids were young, and I had a very high energy. So I needed the retreat, and I've learned that I get much more accomplished when I'm able to step back and retreat. Much, much more. So Ayurvedic, we talked a little bit, again, science of life, sister science to yoga. There's 5 basic elements This is pretty universal. Space, air, fire, water, earth. It's kind of what everything is made of. So being an all-encompassing kind of moves down to, if you kind of keep stepping down, 3 different body types, 3 different doshas. So predominantly, we all kind of wax and wane a little bit on both sides. So Vata, Kapha, and Pitta. So if you really kind of want to, this is a quick little quiz, dosha quiz, the Chopra Center, which is out west, Deepak Chopra. He has this little quiz. It takes like, 2 minutes. And it comes up with, for the most part, your specific dosha. So what your specific body type is. As a rule, you don't really change over time. I mean, sometimes your thinking and how you deal with stress, like my dosha is the same as it was 15 years ago, but my way of thinking, I'm able to move into those other different types a little bit smoother, a little bit freer. Very busy slide. I don't like busy slides, but this one was a good one, so I thought, hey. Qualities, as far as Vata, irregular, kind of rough, flexible, very high energy. Physical attributes are usually small boned. Ayurvedic principles focus a lot on digestion. So their digestion and excretion can be sensitive, irregular, jittery, though deliberate in their actions. So this is all a Vata personality, if you will. Easy to excite, kind of flitty. Creative, tendency towards anxiety and stress. You could put any adolescent in that category. Pitta is what I am. Intense, fiery. I've got a very fiery personality. Medium, average size, consistent energy levels. I would have disagreed with the sleeping, sound yet short sleep. I would have disagreed with that 10 years ago, but now that I've actually been sleeping, that is very accurate. So when you catch babies for a living, you don't sleep very much. So warm skin, irritation. Look at me, I'm a white girl. Okay, I'm very, very, very Pitta. So intellectual, high concentration, determination. If that is the one quality in my personality, is I'm a very determined personality. Very, very determined. So I am very, very Pitta. So, there are times, though, where I have to calm down and I have to kind of move into more of a calming, nurturing relationship. So I focus a little bit more on what I need to do to increase my kapha. Cold, solid, steady, thick, oily, large boned, sound and lengthy sleep. Put most men in that category. Just kidding. Calm and nurturing. A natural tendency to really care for others. Tend to be a little bit more of like a fight or flight. They fly, and when they're met with resistance. So you can't put everybody in these 3 categories, but you can kind of look at what your predominant traits are. And a well-balanced person would be a little bit of everything. So, and that's the focus, is balance, is to try to increase our balance and really focusing on how to do that. So, and you can't do this in a 15-minute visit. You really need time in order to incorporate a lot of this. Foods, different body types need different foods. According to my dosha, I should not be eating bananas, but I love them. So, I'm more of animal proteins, instead of the red meats, my body does better with eggs, which is true. So if I want to increase, my more nurturing side, then I focus on those kind of foods. So the first thing that you can do is to heal your gut in order for your body to really be able to, absorb the nutrients, is to heal your gut, which, again, it takes time. The animal crackers and Coca-Cola that I had at 3 a.m., for a lot of years, needs time to heal. I mean, it's an inflamed bowel response. I can't expect myself to all of a sudden be this perfect person. So you have to meet the person where they're at. So water is the best way to heal your gut. When you get up in the morning, drink a couple of glasses of water before you do anything else. Flushes out, gets the digestive enzymes going, and it shouldn't necessarily be cold. Depending on the time of the year, can kind of determine what kind of water you should be drinking. But a 16 ounces, 2 full 8-ounce glasses of water when you wake up in the morning. can help get all that secretion so your body absorbs the nutrients better. All right, so Reiki. We talked a little bit about it. I showed you how to rub your hands. Japanese technique, 5,000 years old. This is very, very old. People have been doing Reiki on this planet probably longer than that. Spiritually guided life force energy, based on the idea that an unseen life energy flows through all living things, depending on your religion, even some non-living things. So, balances all levels of our being, physical, emotional, mental, spiritual, enhances our our body's natural power to heal itself. So a Reiki provider isn't intending on healing you. I'm not here to heal you. It's your body that takes the energy and heals it from there. Different types of Reiki. Why? See, I don't need much in my notes anyway. There's different, developed in the early 1900s. There's this new holy fire Reiki that really incorporates, transcendental approaches. So that's a little different for, some people. And again, as research unfolds, we're going to be able to really incorporate a lot of these modalities. Oops, got ahead of myself. All right, so bioidentical hormones. There's 3 predominant types of estrogen. Estrone is the estrogen of menopause. That's what your body has mostly after you go through menopause. Estradiol is when they're cycling. And estriol is when you're pregnant. So, different phases of our life, there's different types of estrogen. So, as a woman moves from cycling into menopause, those estrogen levels are trying to balance themselves, which can often cause a lot of issues, irregular periods and hot flashes and, irritability and moodiness. So the focus on bioidentical hormones is really to balance these types of estrogens. Our bodies also need progesterone. So sometimes a cycling woman needs more progesterone because her estrogen is too high. Fat cells carry extra estrogen. So someone with a higher BMI, overweight, a little bit like me, higher estrogen is going to cause heavy periods. So in order to bring it down a little bit, you have to balance it somewhat with the progesterone. So scientific medical modalities, Western medicine uses hormones. 10, 15 years ago, they came out with the Women's Health Initiative. And then they kind of really tried to rescind it. The Women's Health Initiative, you really weren't comparing apples to apples. Women in their 60s were being studied, and they were placed on estrogen and found to have increased risk of breast cancer. But their bodies weren't used to it. So the research that's coming out now is saying that if your body is used to the estrogen when you're in your 50s, you start when you go through menopause, because that can vary, it's a little bit better metabolized and your increased risk is not high at all. I mean, again, there's family history, there's all sorts of aspects that go into this. But bioidentical hormones are more geared for your particular body type. They're not made from horse urine. They're not even plant-derived. They're really drawn from a person's body type. Okay, so because your estrogen needs to be specific. If you have a uterus, your body still needs the progesterone. So a woman who comes to me in menopause and she's having concerns with hot flashes and night sweats, and she wants to be on hormones, we decide that together. Bioidentical hormones have been researched to show that they are not as a lot of research. There's newer. I have to be careful when I say what I'm saying because I don't want to misspeak at all. The newer research is really coming out showing that the bioidentical hormones is more beneficial for their bodies. Because it's more related, so, as time goes on. Other androgens, we as women, we do have testosterone. DHEA kind of balances all of the hormones. So when we're looking at bioidentical hormones, these are the main things that we're looking at. So, a woman who is still cycling, if she wants to be on hormones, absolutely we can check the hormones, but it's going to be more geared towards progesterone. Busy slide, but the most important part of it, so the microionized progesterone, 176 women, 6 months, they reported an overall 34% increase in satisfaction when they compared to their previous HRT, which is hormone replacement therapy. Okay, and this is out of the Mayo Clinic. Okay, these people are the gurus. You know, they're no joke. So 50% improvement in hot flashes, 42% less depression, 47% less anxiety. So cognition, sleep, menstrual improvements. So there's really a lot of research going into this. Bioidentical hormones have to be done through a compounding pharmacy. You cannot get it from your general pharmacy. Pharmacies, usually order medications, they have on their shelves, and they give them to you. These are specifically crushed and compounded for you, specifically. When we look at the hormonal levels, we compound it all together to find out what's best for your body, depending on where you're at in life and the different types of estrogens and progesterones that are floating around. Cortisol levels, testosterone levels. It's really a huge, all-encompassing treatment. Saliva testing is available. What not covered by insurance in New York State most of the time. In addition to saliva testing is capillary blood testing. So instead of going to a lab and having your blood drawn, you can prick your finger at home and fill up the holes on the thing, send it off with your saliva, and it can give us the same, actually much more information because it really looks at the actual availability, the bioavailable levels of this actual steroid hormones. You can do the combined saliva and capillary testing. So when I have somebody who comes to me that wants bioidentical hormones, and there's a lot more people that are starting to really want bioidentical hormones. So instead of sending them directly to the lab, I talk to them a little bit about the saliva and the capillary blood tests. Again, the problem is the insurance coverage. So sometimes I order what I can at a lab. You go to the lab, you get what you can, and then we add the rest of it with the saliva testing. So there's little kits in a specific lab that runs them. So again, increasing in research and very, very accurate and very safe after reviewing all of the risks and benefits. And different people have different family histories and cardiac problems, and I don't want to say that it's for everyone. But so questions about bioidentical hormones before I move on. A lot of it is based on symptoms. So if you come in with specific symptoms, we check your hormones, we develop a specific type that's for you. Your symptoms improve. As far as the way that I believe, the less the better. If a very low dose is effective and you notice an improvement, we recheck the hormones after 3 to 6 months and we keep you on that level. So the Women's Health Initiative that came out, what we did learn from that is we learned that women who are on hormones from perimenopause in through menopause straight through, they do have a much more benefited effect on their cardiovascular systems and their bones, as opposed to someone who comes in at 61 who's already gone through menopause 10 years ago and then giving them estrogen. That's actually not good for the body at all. Less so with bioidentical hormones, but really looking at that. So as far as how long, it's very patient dependent. So just like regular hormonal replacement therapy, after a year or two, if you want to try to wean off of it and see how your body does. So, but a lot of women are on it for quite a while. And if they have an increase in symptoms, we can check the hormones again and adjust the dosing that's specific to them. Other questions about that? So, and there's different compounding pharmacies in the area. Again, I think we'll probably see more and more of them. But the compounding pharmacists don't just do bioidentical hormones. Thyroid, I'm not an endocrinologist. I think that if I find a thyroid problem, that's something that needs to be referred out for me. So I can't specialize in everything. But it definitely, if your thyroid's off, everything else is off. So very frequently we have to look at thyroid. Male hormones, there's breastfeeding creams that have been a lot more beneficial for moms who've had chronic problems. Yeast creams, compounded medications that are specific for yeast and vaginitis. So it's not just, bioidentical hormones that I would work with a compounding pharmacy with. They have lots of things. And for this person who's come, usually the person that I see is they have tried everything, and they can't take it anymore. And then we move into, this is our options. So, how can you be your best? So, diet, stress management, okay? Piece it on. You don't want to all of a sudden set yourself up for disaster. I remember I'm going to lose 50 pounds, and I'm going to exercise every day, and I'm going to meditate. I'm setting myself up for disaster. So really meeting the person where they're at and start with a couple of glasses of water in the morning before you eat anything. Start with that for a week, and then go from there. Natur-Tyme foods and vitamins. You know what you're getting here. A lot of places you don't necessarily. ThriveMarket.com, that's bulk foods that are very, very cost-effective that come from the Chopra Center. They use, overall local areas as well. Essential oils. Read. More books, the better. Okay, and decipher, come up with your own conclusion. And if it's a medical concern, talk with a provider about it. I'm not here to be telling you guys to diagnose and treat yourself. That's not my job. My job is to try to open up the doors a little bit. That's the purpose of this lecture, if you will. So, and then Ayurvedic, just ideas, little notions. We talked a little bit about the water. A glass before meals helps with digestion. Room temperature. When all else fails, drink. When we go out to dinner, we get ice water. They hand us ice water. So ask for it room temperature. They don't mind. So a little bit of lemon kind of brings all of the toxins up to the surface, and drink with a straw. So that's stay away from styrofoam and bottles and anything that can seep into your water. I've got it's in my bag. Ginger, lemon, honey tea. You add whiskey, you add cloves, it's a hot toddy. The same. So, a 1/4 inch of fresh ginger, a whole lemon squeezed fresh. Very important. And then a teaspoon of honey and 8 ounces of hot water. Obviously to taste. Don't burn your mouth, please. But this is for cold and flu season that's upon us. You feel a cold or a flu, ginger, lemon, honey tea. Okay, you don't have to put anything else in. Just water with ginger, lemon, and honey. So my daughter was over in Ireland, and this is how I know a hot toddy works, because she was as sick can be. And those little Irish people gave her this with whiskey and cloves. And she was better in 2 days. I don't know if it was coincidence, but anyways, this is an Ayurvedic recipe. So, and then we talked a little bit about the water. JoyfulBelly.com has wonderful suggestions for Ayurvedic recipes, and you can just play on that website all you want. And then I know I went backwards up, but yoga. If you're not in active yoga practice, to increase your yoga, it really will, over time, really change how your outlook is. It's the only time my brain will shut off is right after yoga, doing our last pose, I'm telling you. My brain does shut off, which is rare. Okay, so we'll end with a 16-second meditation. If you're open to it, again, I got this principle from David G. I am going to turn the lights off for that. Ooh. If you're comfortable, so just take a minute or two and a couple of deep breaths to close your eyes. Slowly think about the breath going in your nose over the count of 4. Hold your breath for the count of 4. Slowly exhale for the count of 4. Watching the air leave. Hold the breath out for a count of 4. Now when the body wants to, let the air enter your lungs again. take a minute. Just notice how it feels. And when you're ready, you can open your eyes again. Come back into the room. So literally, over the course of just 16 seconds, your cortisol levels dropped, your stress hormones were dropped, your fight or flight response dropped just over 16 seconds. Now, I agree, we don't sometimes have 15, 20 minutes to really do meditation. But that was meditating. So if you've never meditated before, you just did. Okay. And we can incorporate that I incorporate it a lot with my 13-year-old. Let me tell you. So it's very, 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 very helpful. And there's lots of little suggestions here and there. You got your 16-second meditations. You got your, your 10-minute. You got to put your earphones in. You can do 10 minutes. There's apps out there. There's books galore. So that's really a really good place to start. Again, that's just a place to start. Yes, I shut my door. I do my 6. It turns into more of a 5 to 10 minute meditation usually. So are you guys ready for the lights back on? I don't want to shock your eyes. Okay. So I end with that, and I welcome questions and concerns.